A very good morning one and all. Today we are going to discuss on the topic first dental visit. So ideally we all know that first dental visit for adults could be at different times, but for what exactly is the ideal age for the child to come to a dental clinic, and what are the advantages and disadvantages of it, what are the prerequisites for it, what exactly is a first dental visit, and so many other things about it we are going to discuss. So let us see the contents about first dental visit. The role of parent in preparation of the child for their first dental visit. Ideally, the first dental visit should be within 6 months of the eruption of the first tooth, or even before, depending upon the requirement. So, let us see the contents. The parent's role in preparation of the child for the first dental visit, the pre-appointment behavior modification, the pre-appointment mailing, the pre-appointment modeling, the recommended procedures that can be carried out in the first dental visit, the examination of an infant or toddler, how should we do the examination, and the tips to prepare the child for the first dental visit, etc. So first dental visit, like I said, can vary. Traditionally, it should be within 3 years, but according to NOVAC, it should be no later than 12 months. And according to American Association of Pediatric Dentistry, it should be before 6 months, like I already said, before 6 months after the first tooth of eruption. What are the reasons for disruptive dental behavior that we usually see in the clinic? Why does the child behave in a negative way whenever he comes to dental clinic? The reason, there is a small hypothesis according to Leishner. The Lenchner hypothesis is maybe it is because of the behavior management, and maybe because of the mother and father discussing dentistry at home, and the child must have overheard about it and must have thought something negative about dentistry, and the anxieties that children have. And also sometimes the parents tend to threaten the child that I am going to take you to a dentist, and it looks like a punishment, which is again wrong. So that is the reason for disruptive dental behavior again. And last point is well-intentioned, that is already the parent must have a well intention of treating their child properly, but that might not have been conveyed to the child in a proper way. So again the child is thinking of something negative, impact must have been there in the child's mind. So these are the 5 reasons why usually the child will have a negative impact about dentistry. Therefore we understood that the role of the parent is very before the child comes to the dentistry, to the dental clinic. So it's an important role. The parents, what they should understand before bringing the child to the dental clinic is that their role is important, number 1, and 2, that they have to ask the dentist beforehand about the procedure, what procedures are to be done to the patient, and they have to have an idea about it so that they can explain the procedure to the child beforehand. Next one is they have to bring the appointment records of the child. If there is any previous record, any medical history, any dental history, any past history, they have to bring that record along with them to the dentist, discuss and understand and have a complete understanding. And they have to plan the course of action correctly. And last and not the least, very important, they have to talk to the child about the treatment and explain it to him in a proper way, in a way that the child could understand. So pre-appointment, some parents, as we said, do more harm than good, and they have to provide the direction for preparing the child. Whenever we treat the child, we have to have somebody else standing beside the child who the child already trusts. If that person will say that this is normal for you, then it is very easy for the child to accept the procedures, what we do. Otherwise, it will be very difficult for us to make the child first accept us, have a rapport with us, and then get the treatment done. So look at this point where this says avoid conversation of unfavorable references to dentistry. Usually what happens is, look at that child, he is getting injection, so you also getting an injection. So if the word injection is going to threaten the child, and if you're using that kind of references, that is going to harm the child's behavior again. So there are so many things that before the procedure starts itself, we have to modify, we have to tell in a certain way, so that the before mindset of the patient or the child is not disrupted. So in order to do such things, what as a dentist we can do is something called as modeling, where we can train the child and we can tell him that this is not something harmful. There is something called as audio-visual modeling and live modeling, where we can show their own parent or another sibling or another positively accepting child who is getting the treatment done, and we can show that whatever the treatment they are getting done is not harmful, and it is easy for them also to do the same thing. So that way modeling will help them to understand that they are going into a non-harmful situation, and it is not very scary. Like I said, audiovisual modeling. Audiovisual modeling is any video that we already pre-recorded, like a film or a cartoon that could help them understand. And live modeling, like I already said, the parent who's already getting the treatment done, or another sibling who's already getting the treatment done, or any friend of them, or any other child in our own clinic who's getting the treatment done in a happy way. So what are the common procedures? Now, since the child has already arrived into the dental clinic, what are the common procedures that we can do if this is the first dental visit of the child? If this is the first dental visit, we can start with taking the history, the previous medical history, previous dental history, oral examination can be done. Secondly, we can do some extraoral examination, overall body examination, intraoral examination, and we can emphasize about oral hygiene instructions. We can teach the child about oral hygiene and the needs for prevention and what all fillings required, whatever treatment is required, we can explain and make them aware about it. If required, any radiographs are required, means we can take those radiographs. And any simple procedures which are not complicated, using least of the least instruments like a small cavity filling or oral prophylaxis. Only these very minimal techniques, whatever treatments are there that we can do, like oral prophylaxis, restorations and topical fluorides. By doing that, what we do is we make the child more comfortable, less frightened and less stressful. That will create patience and calmness in the child as well as the parent also. So, and another thing, if the child is under 2 years, it is important that the mother or the father stays within the child and within the proximity. This is because the child will have separation anxiety. If we send the mother outside or the parent outside, the anxiousness of the child will increase and he will never cooperate with us. So under 2 years or 3 years, the parent must be there in the treatment chair along with the child. So all these effects are at the end to make the treatment more enjoyable, comfortable as much as possible for the child. So coming to an infant or a toddler. Infant or a toddler, most commonly what we'll be seeing problem with their teeth is itchy gums, irritated gums, redness in the gums or natal teeth. Natal teeth are those teeth that erupt within 1 month or at the same day as they are born into the oral cavity. These teeth, they have the tendency to hurt the tongue on the sublingual side. Whenever they try to chew, whenever they are drinking milk or anything, the teeth will irritate the tongue on the ventral side and it will create an ulceration. So this teeth has to be extracted, but it requires minimal LA, that is local anesthesia, for extraction, and that procedure has to be done immediately so as to avoid swallowing of those teeth if they are mobile and to relieve the sublingual ulceration, which is called as Riga-Feed disease. So to relieve these symptoms, we have to extract those natal teeth. So these are the conditions commonly observed in infants and toddlers. So if they come to the dental clinic, first of all, we have to introduce dentistry to their parent and explain them this risk assessment and explain what has to be done and why it has to be done, because none of the parents will be ready for an infant or toddler to get teeth extracted or any dental treatment. So we have to explain the parent. Basically, first dental visit, the chapter is all about explaining things and making them more comfortable and create a rapport with the dentist, and so that the patient or the parent are comfortable with the dental treatment. Mostly it involves prevention aspects as well. So in order to understand the nature of the parent, we can prepare a questionnaire about their previous understanding about dentistry. We can have a ready-made questionnaire ready with us and we can ask the parents to fill it in order to understand their level of understanding about dental treatments. This questionnaire will give us an idea about what they are thinking and what their attitude about dentistry is. If they are willing for the treatment or not, whether they want the proper treatment, or are they convinced with the rate or with the time or with the number of schedules the appointment will be taken. Whenever we are dealing with infants or toddlers or younger children, what we have to keep in mind is, first of all, the parent should be present, and since the toddler or the infant is very small, the dental chair is not necessary. We have to do our treatment on the lap or on the parent's lap, or we can join the two laps and make the child sleep over the lap and we can do the procedure. The dentist would be sitting at the back side, the parent would be sitting in the front, and on a comfortable chair, the child would be resting on the laps of both the child and the parent and the dentist. And the dentist will be sitting on the head side of the child and we'll be doing like this. That is called as knee to knee position, what I just explained. So the recall visits, The appointment should be such that it should be in the morning time, and recall also the appointment should be in the morning time when the child is very much fresh and active. The visits should be as much as possible lesser. We should keep the appointments short and less and try to finish it up fastly. Since we have discussed that how we can prepare the parent, now we have to guide the parent also how to prepare the child. So we can arrange for some booklets, for some short films or any toys or something like that, that will make the child understand, so to bring it to the level of the child for him to understand. Like we can get a storybook ready, a small short film ready, and any other storybook or any other doll which will have bad teeth or something, where the child as a dentist will play with the toy as a dentist. So eventually he will allow the dentist also to work on him. So play a dentist with your child. Make the dentist, the child a dentist, or you be the dentist at home. The parent can play dentist with the child, and that way again a positive feeling about the dentist can be created with the child. And any other fears among the parent or the child can be first of all discussed. If they are not able to discuss, we also can try to question in such a way so that they can come out with their fears and anxieties. And we have to explain it to the parent also, that nothing is to be hidden, and they can explain everything that they are scared about to the dentist. That is what it is. Do not be afraid to talk to your dentist. And another thing that the parents do is they usually convey their anxiety in a direct or indirect way to the child, that if you don't get this done, something will happen to you, or some in a negative way. Usually the child tends to observe their parents a lot. So when they are observing the parents, even a small difference in their expression also the child can catch. So that is why the parent has to be well prepared beforehand, especially when we are dealing with younger children of lesser age, 5 years, 6 years of age. They are very, very cautious about what the mother or father are thinking. That's why the parent has to be told that they should not convey their anxiety to the child. Instead, their anxiety should be conveyed to the dentist, to us. So similarly, watch what you say to your child. Like I already said, do not use the words injection or certain words that are going to be scary to the child. So such type of words should not be used in front of the child. And another most important thing is, some mothers are overprotective, and because of that they feel that if the child cries during the treatment, it is something bad. It is never bad. It's because the child is anxious and extremely scared. We can calm down the child, we can take time, we can do this procedure slowly, but it is never wrong if the child is crying during the treatment in the dental chair, unless it is because of pain. So that is why we can allow some time for the child to spend with the dentist, create some rapport with the dentist, and meanwhile the parent can be there around a little while, so that the child can speak himself to the dentist and create a little bit of rapport. That will also help the dentist to do the treatment. Like I said, toy support, where the child will be given a small toy to play with, so that he will get used to the environment and he will be happy and comfortable with the environment. So these are the few things. This is a very small topic which basically conveys first dental visit and the treatment that can be done, and the behavior modifications and the mentalities of the parent, of the child, and everything. So like I said, in conclusion, I want to say that the parent and the child should be, before coming to the treatment to the dental clinic only, their modifications should be identified and modified in a proper way, so that they do not consider dental treatment a punishment but a reward and something that will help them in the future. Thank you.